I think we have to be smarter already, no, than what we've been doing in the past year. We're trying to innovate and trying to evolve. Kasi po, yung lockdowns, kung mapapansin natin, well, ako personally, nakita ko rin, when the NCR lockdown, the latest, no, parang hindi naman na rin ganun ka-effective. A lot of people were already exempted, and a lot of people were carrying on about their work, and it somewhat reduced, no, the traffic, but pero meron pa rin, di ba? So nakikita natin, because I think people now understand the disease better, they think they can manage it better, and therefore they are braver already in going out and really trying to be productive even during lockdowns. Ngayon, siguro, knowing that, the inevitable solution will be to be flexible. And I think yung granular lockdowns are a step in the right direction. It honestly, I think it will not be as effective as wide and massive lockdowns. But if you want to balance economy with health safety, it really will not be as safe, no, if we have smaller unit lockdowns. That's really going to be the trade-off. But yun nga, ang silver lining is people are more aware. People are really wearing their masks more now than before, and hopefully they can manage by having alcohol, by washing their hands, by staying clear of crowded areas, so that they know how to avoid the disease. Alam na ng tao kasi what to do.
Okay, we all know what to do, or at least that's the presumption. We have, in fact, in many cases, information overload. Yung iba pwede na nga mag-nursing sa dami ng napipick up sa Google, etc. No? But the question is, the two vital weapons against COVID-19, testing kits and vaccines. Is there enough going out or being distributed to the provinces, or kanya-kanyang bili pa rin?
Well, dun sa testing kits, there is support from the national government. But a substantial amount din binibili na rin ng mga local government yan. I think even private corporations have bought a big share of the supply that's going around. And I think that's good na ina-allow at ina-encourage natin ang private sector to do their own testing protocols na rin. Basta sumunod lang sa guidelines so that hindi naman wasteful at hindi naman oppressive yung system ng testing. Pero tingin ko tama yon na niliberate na natin. Vaccines is a different discussion altogether, Sir Cito. Alam mo naman po na under an EUA situation, talagang hindi pa pwedeng masyadong i-liberalize. Although we're already appealing to the medical experts to expedite the commercialization of those that have been granted in other countries, those vaccines, so that private sector can also start buying openly. LGUs can now buy easier, hindi na kailangan yung tripartite, multi-party agreements na ginagawa currently. Magiging mas accessible, madadagdagan natin yung quantity.
Yung sinasabi ni Mayor Bing na nagkaroon ng stumbling block or roadblock because yes, the first time out, you all got to buy your vaccines, but it stopped. And what worries me, and I'm being very transparent, is what worries me is we vaccinate Metro Manila, but we completely forget about the rest of the Philippines.
Yes, Sir Cito. Tama si Mayor Bing. I completely agree. And I was there during the negotiations. I was part of those LGUs that were able to buy. I think there were only about 7 provinces out of the 39 LGUs, but we were able to buy substantial amounts. So I think hindi ako nagkakamali na sa mga 16 million ang nabili ng LGUs, 16 million doses. So, and then nagkaroon nga ng stumbling blocks, existing laws making it difficult for LGUs to buy. That's why that new law that was passed in March was supported so that it will cure all the roadblocks, no? So, but when we were buying back in December to January, February, That was for the supply of this year, 2021. Ngayon, pharmacies like pharmaceuticals like Astra and maybe a couple of others are willing to talk to LGUs and accept orders. But those orders will be for next year pa, 2022. Until this point, I know of the large US pharmaceuticals that produce the mRNA are still not comfortable dealing with LGUs directly. Gusto pa rin nila national government lang. So those are the limited options and flexibility of LGUs. Alam ni Mayor Bing. Kaya nga
Yeah.
kung yung mga nabigyan na ng US FDA or ng EU permit na commerciality, mabibigyan din natin. Hindi na natin kailangan mag-MPA. Even private sector can now buy in your nearest drugstores. So it's just a matter of getting the tests done and getting the documentation done by our experts nga po.
Okay, what is our current situation as far as vaccination is concerned? Sa mga in provinces, I don't expect you guys to know all the numbers, but guesstimate how many percent of the population in provinces and cities outside Metro Manila are partially vaccinated and fully vaccinated.
Sir Sito, if I may go first, no, medyo mas mababa sa mga probinsya. That has always been our cry, no, na parang give us please our fair share because we're all Filipinos and we also need
Mhm.
vaccines. Um, but I think back a few months back, about 3 to 4 months back, all experts were suggesting Metro Manila muna eh. No, yung Okta, yung DOH experts, they were saying let's concentrate on Metro Manila. Let's make sure that we control the surge there so that it doesn't spread. So now the national government has committed na hindi. Talagang equitable na talaga tayo ngayon and sa average ngayon ang tansya ko po kasi last month nasa around 15 or 16 sa tingin ko by now nasa 18 a little less than 20 siguro ang average ng mga provinces. There are few that have reached about 30 to 40%, trailing behind Metro Manila, but may ilan lang 'yon.
Well, on the part of the legal cities, as early as December, we were anticipating this. And somehow, because of our aggressive push, we were able to be part of that multi-party agreement, in which it was a combination of the private sector, the local governments, and then the national government itself. So much so that because of that agreement, supposedly, in the eyes of the pharmaceutical firms outside of the Philippines, they were already supposed to be dealing with the national government by virtue of that. We had to seek special authority, and in that particular case, we had to get Malacanang to say yes to that, and even no less than COA chairman Mike Aguinaldo, because we were in that point to deal with advance payments, which is not normally being allowed in government. So we were able to do that now. But then that was just the 39 LGUs. And this, in the second batch, I understand is hitting a roadblock. And until now, I don't know if they were able to finally resolve the kinks there. But I believe that should be the right direction. We should get the LGUs involved, and that way the national government also makes a lot of savings.